Good morning, everybody, and welcome back to your Lunch Break Live. My name is Ivana Harinkyu if you're new here, and if you're not, thank you for coming back. Today is Monday, May the 9th, and it is also the first full day that Alabama's new law that bans transgender medical treatment for transgender minors, I should say gender affirming medical treatment for transgender minors, goes into effect. That law went into effect yesterday. Today is that first full day again. So today, to talk about this new law, to talk about the treatments that kids and teenagers are going to miss, I am joined by Dr. Hussein Abdul-Latif. He is with UAB and Children's of Alabama at the gender clinic there and is also a professor as well. Doctor, thank you so much for joining me today to get the word out about this new law going into effect today. And, I know that you treat, again, kids and teenagers who have gender dysphoria and who identify as being transgender. So I'm sure the last few weeks at your clinic have just been very emotional and have been very hectic. Can you tell me a little bit about that?
Yeah, it's kind of like really the big questions by many families, like what will happen? Where are we going to go from here? What are our maneuverability? How do we maneuver it? But also our office, this office staff receiving lots of phone calls from families. Does that mean I cannot see the doctor anymore? Does that mean we cannot schedule a new patient, a new person visit to come visit the clinic? And our office staff or nurses, does that mean I will go to jail if I triage, I see a patient, or I do this or I do that? So it's kind of lots of questions that in the beginning of the law were scary for many of the people in the office, where they stand themselves in the law, and does the law affect them in any way or not, and how can we protect them from the effect of the law? So yeah, and then eventually, kind of towards the last few weeks, the last week or two, it was more of okay, reading the law in very great detail and paying attention to details, and so we discovered that thankfully the law does not criminalize pharmacists for dispensing medications that were prescribed before the law took effect. So we made sure that I pick up as many names as possible of the kids that we see in the clinic and check their prescriptions, make sure that they do have refills and prescriptions that are updated to their pharmacists. So that's kind of basically where we are.
Well, and I want to talk a little about that because that's been kind of almost a gray area, it seems like, for a while. And I know you said that you and people in your clinic have been trying to figure that out over the last few weeks. Alabama is actually the first state in the country to have this type of law about banning the gender affirming treatment for transgender minors actually take effect. It's not the first for it to pass, but it's the first to take effect. So this is new for the country here. So I know, again, it's even more stressful, I'm sure, for you and for your colleagues to figure it out. But you talk about pharmacy. So tell me a little bit about that. If I was a patient of yours prior to the law taking effect yesterday, today being that first kind of business day of it taking effect, and I needed medication, how would you handle that? Or tell me some instances of how that treatment will be able to proceed.
Yeah, so the law does mention towards the end of the writing of the law is that the law does not affect pharmacists filling prescriptions or refilling prescriptions. So with that, it means that pharmacists can refill the prescriptions without being intimidated by the law into thinking that they are breaking the law themselves. So that's how they wrote the law exactly. I think that was probably because of some effective lobbying by pharmacist groups to get them excluded from with the lawmakers that wrote the law, to make them protected for filling medications. And it's understandable because people write those prescriptions for so many different reasons. So the pharmacist cannot be an inquisitor into, like, why are you having this prescription, and asking all those difficult questions complicates it and made it easier for the legislature to write the law. Hopefully, by doing that, we're buying our kids a few months of getting some prescriptions filled and refilled. Now, although the law says that, perhaps not many pharmacists are not aware of this. And so because we did have some phone calls of families that were refused on two occasions, where they were refused to fill their medications because the pharmacist in that local pharmacy that they used said it's against the law, when it is not against the law when it comes to pharmacists giving the medication.
In an instance like that, what do you do? Do you have to call the pharmacy and say, look, this is not breaking the law? My patient had this prescription written before the date of this new law and they need to refill it. Is that how you've handled it?
Well, in one, like those two occasions that happened, and one of them, like basically the day after the governor signed it, and the prescription was not even for the medications that were prohibited. It was like a form of birth control that we use to help people not have menstrual cycles, which is a cause of gender dysphoria. And when I called the pharmacy, there was no discussion. We're not going to fill this medicine. So we had to send the prescription to another pharmacy, basically, probably a few doors down, and they were happy to fill it. The other incident happened just Friday when a parent was informed by their pharmacist through text that the time of the refill of the medicine was Friday, and the text said, "We're not going to refill your medication." So we talked, the father and I said, "You do want to?" I advised the father to call the pharmacy and tell them there is no law yet, and is this like a policy? Is this like a nationwide policy by your pharmacy, or is it like where are you coming from? And when he called back a few hours later, the pharmacy did dispense the medication. So that was, that was a discussion that happened. I anticipate that perhaps we may have to talk to pharmacists more often over the coming few days, and I hope the judge will give us an injunction in a few days, and then we don't have to worry about this lasting longer. But there will be probably a good number of phone calls between us and pharmacists over the coming few weeks and months, if the law keeps in effect, to explain to them what I can and cannot do, but also what they can do and they should do.
You bring up a instance where a birth control medicine was not filled. The law prohibits treatments that are gender affirming care. Now, there are also medications, though, and other treatments, I would assume, that can be used maybe for gender affirming care, but are also used for many other reasons, birth control being one of those. So, how does a doctor, how does a pharmacist, a nurse, anybody in the medical profession, how do they know if this drug is being used for gender affirming treatment or if it is being used for one of the other several treatments that this drug could be used for? Is that a job of a pharmacist? Is that a job of a nurse to inquire about the reason? Or can you write the prescription and not ask questions?
Yeah, you're bringing up a very important point, which is all of those medications that were prohibited are actually allowed under different diagnoses. So there is an element of discrimination here because the writers of the law said that those are harmful medications. Well, if they are harmful, they should ban them for all the other indications that they have, but they don't. And so we do use birth control for birth control. We do use forms of birth control in order to help a female not have menstrual cycles, because that causes issues and problems or severe bleeding. We do use other the hormones, testosterone, estrogen, for people who do not go through appropriate puberty and or production of their different hormones. So we do it all the time. And that's where it's difficult for a pharmacist to actually know why we do this. Perhaps they can look at the diagnosis code that we use. And so if somewhere in the diagnosis code has something that calls for gender dysphoria, then they will say, no, we're not going to fill it for you. But most patients have many codes, and not one. And so it would be very hard for a pharmacist to figure out why a prescription was written. And that's also one reason why pharmacists should be able to dispense without necessarily asking too many questions. having to ask too many questions or act as an inquisitor.
I know that one of our reporters kind of pulled back the curtain on what's been happening at your clinic over these last few days. And we'll leave that story here in the comments for people to read. But she mentioned about how some of the people in your clinic, some of the staff, some of your nurses were feeling very, very pressured, very afraid, and having a lot of anxiety regarding this new law and if they would be criminally prosecuted for treating patients. So tell me a little bit about that. Is that possible? And if so, how has your staff reacted to that?
Yeah, so I mean, definitely the first few days when when the law came up, I had people come crying really in the office about, I have young kids, I live paycheck to paycheck. If like something happens to me, it's a disaster, and will I go to jail because of that? So it was very emotional the first few days. I mean, thankfully, things calmed down. We had a good idea from from Children's Hospital and from UAB that the clinic will continue. Now, as the law takes effect, there is a good understanding in our office that everything continues the same, but we cannot prescribe medications, and we cannot ask nurses to call prescriptions or to administer medications in our clinic. So oftentimes for puberty blockers, for example, families may bring their puberty blocker to the clinic and ask our nurses to give the injection. Now our nurses cannot give that injection, which then the family will have to find another venue to receive the injection. But whoever that venue that's going to give the injection are breaking the law and subject to prosecution by the law. And therefore, now we're starting to think, can families travel outside of the state for an hour or whatever, go to the closest neighboring state and then give the injection in a clinic outside that state and then come back, which is a headache having to drive for just getting this injection.
Well, and especially with the rising cost of gas, I'm sure some
Yeah.
families can't afford that, can't afford to drive across the state line to give an injection. And I'm sure there are also some families that maybe just administer those injections at home. Maybe don't come get a nurse to do it, or maybe they have some type of training and they feel comfortable enough administering that. Does that mean that a parent, a sibling, the person in the household administering that injection is also liable?
Theoretically, yes.
That leaves, it sounds like, you and your clinic with not a lot of options for treatment for your patients. So again, we do know there is a court case that is being waged right now in Montgomery. There is a judge there says that he expects to issue an opinion, hopefully this week, on that case and about how this case will move forward. But until then, again, this law is in effect. So how do you and your clinic plan to continue operating if the majority of what you do is now illegal?
Yeah, so kind of like, but one of the very important things that we do in our clinic is talk to people, affirm the kids and their families that they're there, that we're listening to them, that we're listening to them with humility, that we understand their worry, and hopefully that law taking effect is not going to last for a very long time. And so we're basically will be talking about the planning for the future of where we go from here, in order to, once the law is not in effect, we are ready to go and start them on their medications as soon as possible. For those who are not on medications, and for those who are and receiving refills, to make sure that they are continuing the refills, because the law is not in effect anymore. I'm optimistic. Hopefully, I watched the proceedings of the case in Montgomery, not live, but reading all the comments, thanks to AL.com and other outlets that gave me a very good and detailed view of how the proceedings were going in Montgomery. And I do feel that our case, the plaintiff's case, was much stronger than the state's case in front of the judge.
Dr. Abdul-Latif, this is 2022. Did you think that we would be here today where it seems like over the last several years, especially culture has been more accepting of people identifying as transgender, people exploring their gender, and that has been something a little bit less taboo in the last few years, at least in the culture world. Did you expect in 2022 mid-year for a law like this to be introduced and to kind of set that community back?
Well, unfortunately, I did, but that's because this is something that's been going on for a few years, from actually 2020, when the first attempt at bringing it to the legislature happened. In Montgomery. Um, at that time, in 2020, COVID happened at the same time, and therefore derailed that process. But then in 2021, there was also the movement of that same basic exact law to pass in Montgomery, and then, but it was not presented to the legislature. So kind of like we were psychologically aware and physically aware that there is such a law that is cooking in Montgomery, and then we're aware of the Arkansas situation. But yes, like as a human being, um, I did not imagine that that would be such a law. I the transgender community is a very small community. Um, to receive such publicity and such visibility in a very negative way by lawmakers, and there's a kind of lots of fear mongering happening with it. That's unfortunate. Yeah, it's very unfortunate. It's very sad. It's surprising that that becomes a much more important issue than finding jobs for people, how to fight inflation, how to help people survive whatever we're dealing with related to money matters.
And I know that a lot of your patients, I believe you actually had gotten them as patients because they had either called in or visited emergency rooms for either suicide attempts or suicidal ideas or thoughts. So tell me a little bit about how this law has affected at least even the mental health of your patients, not even just a physical
Yeah.
barrier there, but it's a mental barrier as well.
Yeah, I mean, it's like I do have a parent who, when we saw in the clinic, she said that she did not sleep for 3 days because of her worries about what the law is going to do. I heard from my colleagues in the emergency room at Children's Hospital that there was an uptick in the population with suicidal attempts and ideation coming to the emergency room within 48 hours of the governor signing the law. The Our psych unit is still, present, still there. I know of some kids with gender dysphoria that are in the psych unit with suicidal ideations, and we're trying to um, we usually, they call us in our psych unit whenever a kid with gender dysphoria is admitted to that unit, in order to, one, in case it is one of the kids that we see, that we need to be aware. But if it's someone we don't see, then they like us to be aware of them, so that we will go and visit them in the hospital and let them know that there is an avenue for them to go forward. And so here it becomes a sad situation where we will go and see them, but the avenue forward does not include medications at this moment. We will have to keep our mouth shut related to medications, but talk about what we do, the workings of our clinic, and how it works, and how we will look at the future.
Does that break your heart a little bit when you have to see somebody who is obviously so distraught and the thing that you could do to help them is no longer legally available to you? How does that take a toll on you?
It, um, it will be a pretty big toll, certainly. That and I know that it's going to put me in situations where I am sad, that I feel paralyzed, that I cannot help. Where in other situations I would have been able to help them, a week ago. Yeah, so I do not know um, how the coming few days will be. Tomorrow we have a clinic for kids with gender dysphoria, and it will be a little bit. I mean, I'm rehearsing that I will tell them that I cannot prescribe medications or or refill past the date of the law. But that's rehearsing it. When it comes to the reality of talking to them uh, and seeing their faces that are oftentimes or maybe heartbroken, that will break my heart too.
And also, you're a physician, you took an oath to not do any harm. Does this law mean that you will be doing harm? And if so, how do you balance that with the oath you took becoming a physician versus the threat of criminal prosecution?
Yeah, and that's a very, very hard question to answer. Because it is an untenable situation. It's an unfair situation to subject any physician to that. My, um, my organizing bodies, the American Academy of Pediatrics, the Pediatric Endocrine Society, which are the two organizations that give me guidelines of what is the standard of care. And it is the standard of care to offer those medications to patients and their families that are coming to me. And then um, I cannot offer them this standard of care. So now I will have to monitor my kids for the side effects and of not receiving medications that they would have otherwise received. And those side effects are harmful because they include suicidal ideations. And I would worry to death. I am worried to death that some kid will arrive to the emergency room at some point, having succeeded in their attempt to take their lives, to hurt themselves.
What would you say if you could give a message to lawmakers who have rallied for this bill and say that this bill, or this law, I should say now, is to support children and to protect children? What would you say to them? And would you disagree with this law protecting children?
Yeah, I mean, I would definitely disagree that this law protects kids, but I would also remind them that we in medicine, when we make a decision about to treat or not to treat a particular patient for any particular condition, we have to take the consideration of the benefits versus the harm ratio of the medications. In that, we understand that there is a potential harm from the medication, but that we believe that the potential benefit is going to be much greater than the potential harm. In my opinion, passing this law, the potential harm is much greater than the alleged potential benefit that the lawmakers are claiming. And so medically, it's a law that doesn't make sense.
And I also, too, just want to give you a chance to kind of debunk something that we've heard so often. And that is, again, how big is the transgender community? You mentioned earlier that it was a small community. There seems to be some thought that if a child just can say, oh, I want to be a girl or I would like to be a boy, that they automatically can get these medications. Can you just kind of debunk that for us?
Oh yeah, I mean, or at least I'll speak for the workings of our clinic. We don't start someone on medications the moment they arrive at our door, and we have certain conditions for them to start medications, and one of them that they have been stable in having transitioned to the gender they identify with for a certain length of time, about a year or longer, and so it's not someone who one day wakes up from a dream and says, I'm transgender, then we say, oh, yeah, we'll give you the medication. It doesn't happen that way. They have to kind of prove that they are, the words that we use, consistent, insistent, persistent, in that for at least a year or so. Shorter than that, we understand that people do change their mind when they are, once they say that they are transgender, but when it lasts for a year or longer, it's very rare to come to change. A recent study that was published last Wednesday showed that kids who identify as transgender and who are in that category that I'm speaking about, 95% of them continue with that gender that they identify with, which is also different from what they presented in this law, that where they said the overwhelming majority change their mind. That's because they cited articles about exactly what you're saying. A kid that comes one day and says, I'm transgender, but then 2 days later, I'm not. We know that kids do that all the time. That's not a transgender kid.
Doctor, is it more important to follow the law or to take care of your patients?
This is a very hard question. I cannot answer it. I honestly cannot answer it. It's there is something about the law that is unethical, and that puts me in an unethical situation. I really don't know how to answer it. I know that the law is harmful. Wow. I am so sorry.
We'll let you get back to us on that one. I do want to give the phone number for the Trevor Project for anybody that feels that they are in crisis and needs to talk to somebody. The Trevor Project's crisis line, can be accessed 24/7. You can access that by dialing 1-866-488-7386. That's 1-866-488-7386. You can also text the word START to 678-678. If you are, again, needing somebody to talk to or having thoughts of suicide, we'll leave that here in the comments as well. Dr. Hussein Abdul-Latif, thank you so much for your expertise on this, for really getting the word out and explaining to people what this new law does, what it doesn't do, and who it affects. Thank you so much for your time.
Thank you. I appreciate it.